Hello, everyone. My name is Brenda Stedemeyer. I work in the Wisconsin water industry, and I am also a plaintiff in a federal lawsuit against the U.S. Environmental Protection Agency over the neurotoxicity of fluoride chemicals that are added to our public drinking water supply. For over 13 years now, I have been reading the science on fluoride, and I have brought it to the attention of Green Bay multiple times to get fluoride removed from the drinking water because it poses an unreasonable risk to the brains of developing children. I have a website called fluoridelawsuit.com, and if you want to look at the studies that have been published since 2015, you can go to fluoridelawsuit.com/science for an archive of all that. There's almost 150 studies that I have there. It's a much more thorough archive of research compared to the Center for Disease Control, which does not have very good science on their website. And a lot of their science is basically what I consider manufactured facts and talking points, where oftentimes you will see the CDC citing themselves as the source of the science. So my archive has primary research studies that have been published and peer-reviewed since 2015. So I raised two children as a low-income mother in Wisconsin and in New York. And it was super hard to protect my kids from tooth decay and obesity and diabetes, because so much of the free stuff that the WIC program and public schools wanted to give to us because we were low income, so much of that stuff had high levels of sugar in it, which promote tooth decay and obesity and all these different diseases that we have. And it was really hard because you need to put a lot of time into educating yourself. I had to put hours and hours, and I had to read many books to figure out how to feed my kids so that they could avoid tooth decay when they were growing up. And a lot of the stuff that WIC and the free breakfast program gives out, my kids could not have. And it was a waste. The American Heart Association and also the Center for Disease Control recommend less than 25 grams of sugar per day. And the free breakfast program my son Co was given at Howe had over 30 grams of sugar in just a few items that included chocolate milk, fruit juice, Cocoa Puff cereal, Trix yogurt, Fruit Loop cereal. And these kids are being bombarded with this every day when they go to school. And then they get snacks of graham crackers and more chocolate milk, and then more chocolate milk at lunchtime. And these kids are on their way to being little cash cows for the dental industry and big pharma. Something that I've been passionate about my whole life is food security. I lived in New York City, and I worked on a school garden in a low-income community where we had a lot of migrant children. I worked with Daniel Bowman-Simon on the WHO Project, which was, we basically petitioned the Obamas to put a White House organic farm on the lawn, and we were successful with that. We also got New York State to allow food stamps to be used to buy plants that people could grow in their garden. When I moved back to Wisconsin, I was involved as a founding volunteer of the Farmery, which was part of the Neighborhood Association. It was part of NeighborWorks Association. We also had an outdoor barter garden where people could trade or barter their labor for free fruits and vegetables. And currently, I am involved in the Seymour Park Food Forest Project, where we are growing fruits, vegetables, trees and edible plants or an edible permaculture landscape. And this pilot program would hopefully get implemented and replicated in other parks around Green Bay, such as Joanne's and Seymour Park, to help promote more food security for low-income people and to teach people where their food comes from. If you're interested in learning the history of fluoride, I recommend these two books, The Case Against Fluoride, How Hazardous Waste Ended Up in Our Drinking Water, and the Bad Science and Powerful Politics That Keep It There, along with The Fluoride Deception by Christopher Bryson, which goes into the history of PFAS and fluoride. Many people are not aware that the EPA states that, quote, fluoridation is not required by EPA, which is prohibited by the Safe Drinking Water Act from requiring the addition of any substance to drinking water for preventative healthcare purposes. In Wisconsin, the Wisconsin DNR does not mandate fluoride, and neither does the EPA or CDC. Fluoride is an optional program recommended by health departments and taken on by city council, who votes it in. And mind you, city council members are not scientists, and they don't have the capacity or the educational background to really evaluate the science on fluoride. And I have found them that they are easily manipulated by fluoride lobbyists. Another thing to note is that the FDA has never approved swallowing fluoride as a way of preventing tooth decay. It has approved topical use of fluoride, but never the ingestion. The FDA defines a drug in part as intended for use in the diagnosis, cure, mitigation, treatment, or prevention of a disease. So fluoride, by definition, fits this. Fluoride is being intended for the use in the diagnosis, cure, mitigation, treatment, or prevention of the disease of tooth decay. So we are using the public water supply to medicate every man, woman, and child and pet, everyone's lawn, their car, the golf courses, the plants in your garden. All the things that you use your water for are being medicated with fluoride, which is just an unreasonable waste of this chemical. And we're spreading it all over the environment this way. Green Bay uses fluorosilicic acid as their fluoride chemical, and it is promoted as a natural mineral and a nutrient. Fluorosilicic acid chemical is highly corrosive. It eats away any electrical, any metal in the room, the concrete. It turns the walls to powder. Any of the glass in the room gets all clouded and stained and etched up. Any of the safety equipment, like the eye wash station, it just eats it away from the vapors in the air of this substance. And then if any of it spills on the floor or any manholes, it'll eat it away. And that happens the same to the delivery men or the people working in the water utility. If they get it on their boots, it'll eat holes through it. Fluorosilicic acid is a waste product of aluminum and phosphate fertilizer manufacturing. And you will see this if you look on your annual water report, the consumer confidence report. You can look up the fluoride level that they've tested and found in our water, and then it says the source. And it comes out of the smokestacks. Basically, they cannot release this chemical into the environment because it is a pollutant and it harms crops and animals, so they have to capture it. And when they capture it, then the industry turns something that they would have to spend a lot of money disposing, they turn this into a profitable product for them to sell to water utilities. And it gets dosed into small amounts into our water. The concentration of the water typically considered optimal is 0.7 milligrams per liter. But this concentration should not be confused as the dose that people are getting, because everybody drinks a different amount of water based on their thirst. So this fluoride medication is basically in our water, and the amount we're getting is based on how thirsty you are. I have never heard of any sort of medication being distributed to the public in this kind of way, and it is alarming. And it should be very alarming for health professionals that should know better. One other quick fact is that fluorosilicic acid should not be confused with calcium fluoride, which is found naturally occurring in lakes, rivers, streams, and the ocean. Calcium fluoride is very different from fluorosilicic acid that is found in the smokestacks of the industry. According to Hawkins Chemical, who delivers and supplies the fluorosilicic acid to Green Bay, their fluoride chemicals can contain up to 50 parts per million or milligrams per liter of each lead and arsenic. The US EPA has primary drinking water standards, which their goal is to have 0 lead and 0 arsenic in our drinking water. So water utilities are basically purposely adding lead and arsenic. And I'm not sure if they're aware of that, if they read the certificate of analysis that comes with their shipment, or if they're just burying their heads in the sand and hoping that people don't notice this. There are many costs of fluoridation that are unaccounted for. You will hear for every dollar invested in fluoridation, it saves $30 some, $40 some, $8. All of these numbers have not taken into account the cost of overfeeds and cleanup and constant monitoring by utility workers. They overestimate these benefits to sell fluoride to us. They're manufactured benefits that just aren't true. Recently, Sandy, Utah had an overfeed that made hundreds of people sick. People were vomiting and calling the utility saying there was something wrong with the water, and the utility said, no, there's nothing wrong with your water. And then in Sun Prairie, a couple months ago, some of my coworkers showed me letters where they got letters from their utility saying that your water is now safe to drink. And my coworkers were like, what is this? When was our water not safe to drink? And why weren't we told about this? So this happens more than people would like to admit. And these costs are never put into the cost of the benefit of water fluoridation. Locals are fluoride overdosed in Green Bay and in Brown County. This fluorosis damage is not accounted for in the benefit of water fluoridation when they do that cost-benefit analysis. Fluorosis is a cosmetic damage, so your dental insurance does not cover fixing this for people. And I've noticed that children with dental fluorosis a lot of times will smile with their mouth closed or hide their teeth because they are self-conscious of this. And when you make teeth more strong or harder, you also make them more brittle. So that means that they are more prone to cracking and breaking later on, requiring more crowns and restoration. So this makes money. Back in 2019, Water fluoridation should have immediately been halted in the US when this study was published. JAMA Pediatrics published a study, and this study had gone through an extra peer review process because it was so controversial. They knew that as soon as this study came out, it was gonna explode. And they found that pregnant mothers drinking fluoridated water had a lower IQ in their children, especially their boys. And the IQ points were around 5 IQ points, which is very similar to what we see with lead. And David Bellinger was quoted in NPR. He is a professor of neurology at Harvard Medical School and Boston Children's Hospital. And he stated, it's actually very similar to the effect size that's seen with childhood lead exposure. This study is being used in our fluoride lawsuit against the EPA. And one of the authors is one of our expert witnesses in our case. So in 2020, I gave the Board of Health, the Water Utility, and City Council a list of NIH-funded studies done at optimally fluoridated levels that found fluoride lowered IQ and increased ADHD. These studies were brought up in our case, and the experts for the EPA agreed that these studies are the highest quality studies that have been done to date. And we believe that water fluoridation should have immediately been halted as soon as these studies started to come out. But the reason fluoride was not halted is because of lobbyists like Johnny Johnson. Johnny's lies delay the action that protect our kids' brains from harm. He takes advantage of scientific illiteracy and poses as a defender of truth and health. At one of the meetings, Johnny showed up in Green Bay over Zoom in July of 2020. He waited to be one of the last speakers at this meeting. He waited until I spoke, my 2 attorneys spoke. We all spoke about our lawsuit against the U.S. Environmental Protection Agency over the neurotoxicity of fluoride chemicals that are added to the public drinking water supply. Johnny stated to the Protection and Policy Committee, basically saying that our lawsuit had nothing to do with water fluoridation. It was about the Toxic Substances Act, which is insane. I could not believe that came out of Johnny's mouth. And it was all recorded. In 2020, Johnny also got involved in Madison. I live part-time in Madison and part-time in Green Bay. I work full-time down in Madison for the water industry. When Madison was discussing fluoride, Johnny reached out to hundreds of fluoride promoters around the country and outside of the country. He got people from all over the place to zoom in and parrot the handful of talking points about how safe and effective fluoride is. Johnny's actions just delayed the inevitable. Fluoride is going to be halted from the water because there is no going back. The fluoride and neurotoxicity research is conclusive. Fluoride is a neurotoxicant, hazardous to human health, especially to the developing brain of children during fetal development and when mixing infant formula with tap water. There is no going back. And in 20 years, we're going to look back at this and think how crazy it was that it took so long for people to break through on this. But we saw it with the lead industry. The lead industry, they taught plumbers to teach, people that the lead pipes were healthy and safe and everybody should put lead pipes in their house. And the same thing with fluoride. The fluoride lobby and the dentist are teaching people and their patients that fluoride is safe and healthy, and you need to paint it on your teeth, and you need to soak your mouth in it, and you need to drink it in your water and brush your teeth with it. Fluoride is highly toxic, and nobody really is paying attention to the dosage that we're getting because we're getting the dose from all over the place. So Johnny also makes up his own facts. He misrepresents the science. Johnny, in his email, sending his email out to the Association of State and Territorial Dental Directors, he wrote to them that the NTP report about fluoride did not find a relationship between neurotoxicity, IQ scores, and fluoride at the levels that are used for water fluoridation. He wrote this in 2020. So all these dental directors took that little soundbite and they started to repeat it. Johnny also came out in 2023 when the NTP report released another draft due to our lawsuit. And he said, the new report reinforces the confidence in the safety of fluoride. No, it didn't. The NTP report clearly states on page 352 in response to an HHS comment, quote, several of the highest quality studies showing lower IQs in children were done in optimally fluoridated areas in Canada. These levels were at 0.7, even at 0.6. But the individual exposure information in those studies, as documented by repeated urinary measurements, suggests widely varying total fluoride exposure from drinking water combined with exposures from other sources. For example, many urinary fluoride measurements exceed those that would be expected from consuming water that contains fluoride at 1.5 milligrams per liter. This statement in the report is alarming and should be the end of water fluoridation. The tobacco industry, the pesticide industry, and lead lobby have written the playbook for merchants of doubt. In 2020, Tuka Zokai from the American Dental Association zoomed into the October Green Bay Protection and Policy Committee meeting, stated how she welcomed the neurotoxicity research and that the 2019 Green et al. Study was done at much higher levels than what we see in water fluoridation. This is a lie. The Green et al. Study was done at optimally fluoridated levels in Canada. In 2021, I caught Casey Hannon, the director of the CDC Division of Oral Health, telling the same lie while preparing federal agency staff before their March 17th Capitol Hill Day, where they lobbied elected officials. These are the people that are teaching the talking points, and I don't think they've either read the science or they're just lying, because they keep saying that these studies were done at much higher levels than what's found in fluoridated communities, and that's not true. The strongest studies we have are done at 0.7, and it's concerning because they found that fluoride at 0.7 is neurotoxic to the brain. It lowers IQ and increases ADHD. Look around. Look at all the problems we have in our schools with ADHD and all kinds of learning disabilities. The lobbyists use these manipulative images and stories to promote and protect water fluoridation. A lack of dental care is what causes infections to spread to the brain and kill people, not a lack of fluoride. Every day in fluoridated low-income communities, children have to go in for emergency dental surgeries. It's an issue of poverty and and food insecurity and a lack of vitamin D and a lack of people accepting Medicaid and Medicare patients. Most dentists don't accept Medicaid and Medicare. They might volunteer a couple times a year at some dental event where they treat low-income people, but they don't take low-income people regularly in their practice. And that needs to change. Dentists should have to take a certain amount of patients, even if it's a low number of patients. If you spread them around to all the dentists, it would really help improve the dental health of everyone in the community. So due to our lawsuit and open records request, we have discovered that Wisconsin State Dental Director colleague Jay Kumar has been caught omitting data to show that fluoridated water is not associated with reduced IQ. Jay Kumar was also an author of the American Dental Association Fluoridation Facts document. Everyone is entitled to their own opinion, but not their own facts, people. And I have printed for the board today the letter that my attorney has submitted to the NTP about Jay Kumar's meta-analysis that was recently published and found that fluoride does not reduce IQ because he omitted statistics and graphs that found that there was no threshold, there was no safe level. The National Toxicology Program found that there was no safe level of fluoride. They could not find a threshold. The Wisconsin Department of Health Services likes to use this slide to promote water fluoridation, and they recently used it for the Marquette dental students. And they claim that when fluoride ends, decay rates go up. In Juneau, Alaska, there was a study that measured procedures of those on Medicaid, but never controlled for two major factors that could have accounted for all these increases in Medicaid use. A large increase in Medicaid funding to dentists in 2008 and 2009 increased the number of dentists accepting Medicaid patients. In short, more kids plus more dentists equal more Medicaid costs for treatment of cavities. It doesn't mean more cavities. And then there was a study from Calgary, Canada, where the Wisconsin State Dental Director says that the cavity rates skyrocketed. The author of that report said that the conclusions are overstated. For example, suggesting that cavities spiked since fluoridation was stopped. There was no spike, but rather a gradual increase. And the trend observed was not since fluoridation was stopped, but rather over a time period where cessation occurred in 2004 to 2005 to 2013, 2014. And they stopped adding the fluoride in 2011. So the tooth decay rates were going up well before they even took out the fluoride, and they continued to go up. The cavity rate only changed in the baby teeth. There was no change in the permanent teeth. The cavity rates were going up just as much before Calgary stopped fluoridation as after. So fluoridation made no difference whatsoever in the cavity rate increase. And then in Windsor, Canada, there were numerous variables that contributed to cavity increases that were never considered in this study. There was a large influx of low-income migrants and refugees in the study period, and Windsor experienced the worst average income drop in Ontario, and low-income families are known to have a higher cavity rate. The survey also said that the percent of cavity-free children went down, but the percentage of cavity-free children decreased as much before Windsor ended fluoridation as after. Once again, fluoridation made no difference whatsoever in the rate of tooth decay. In 2015, Cochrane did a meta-analysis on water fluoridation for the prevention of dental caries. They found there is insufficient information to determine whether initiation of water fluoridation programs resulted in a change in disparities in caries across socioeconomic status levels. And they also found there is insufficient information to determine the effect of stopping water fluoridation programs on caries levels. And no studies were found that aim to determine the effectiveness of water fluoridation for preventing caries in adults that met the review's inclusion criteria. A 2022 prospective longitudinal cohort study reported the prevalence of caries and the impact of water fluoridation was much smaller than previous studies have reported. The benefit was 4%, which is much smaller than the promoted CDC 25% claim. I want to touch upon a recent 2023 study that concludes maternal exposure to drinking water throughout pregnancy, fluoridated at the level of 0.7 milligrams per liter, was associated with poor inhibitory control and cognitive flexibility, particularly in girls, suggesting a possible need to reduce maternal fluoride exposure during pregnancy. This study was done in Calgary since they took out fluoride in the drinking water. I see every day in the Green Bay Police Reports page women that suffer from addictions, inability to manage their emotions and self-control and actions. And it's sad that we have been adding something to our drinking water for so many years. And I have been providing the council and board so many studies that should lead to halting this program. We should back up and say, okay, let's stop this until we can determine definitively if this is safe, which it is not. It's so bizarre that we would participate in something when there's so much evidence of harm that we keep doing it because these fluoride promoters keep manipulating our elected officials and keep telling them it's safe and effective. But at the end of the day, these fluoride promoters are not making the decision. It's our elected officials. And if something might be harmful, then we shouldn't do it. We should stop immediately, especially when there's so many more effective ways to prevent tooth decay. You know, kids can go to the free dental clinic at Oral Health Partnership, at the Kroc Center. They can go to NWTC. They can buy fluoride toothpaste. It's very cheap at the dollar store. And we don't even know how much fluoride children are getting. We don't know how much they're accumulating in their body. We can look at their teeth and see that over 50% of them have this fluorosis damage. So we need to stop and back up and not use the public water supply to medicate the entire population for something like tooth decay. Promote vitamin D, get outside, get some sunshine, and stop drinking those juices. Don't put juices in your baby bottle. Don't put Coca-Cola in that baby bottle. Drink water, clean water, not fluoridated water, not water that's contaminated with PFAS here in Green Bay. And the poor people cannot afford water filters or bottled water. So when I see these local groups being used to support health-harming fluoride, I know they didn't read the science. I know that they were manipulated into signing something. And the scientists that work for these agencies probably were not given the fluoride literature. They were not given the studies that I have archived on fluoridelawsuit.com/science. These people have not read that literature. They are just taking the talking points that the fluoride promoters have provided them, and they've signed on to this thing. And it's just like the doctors and dentists that recommended Camel cigarettes or whatever kind of cigarette back in the day. These local groups have been misled. They have been taken advantage of by fluoride promoters. So last year in 2022, State College stopped adding fluoride into their drinking water, and they conducted a report. And their report concluded there is no obvious advantage of water fluoridation compared with topical prevention for the prevention of dental caries. Pregnant women and babies should not drink fluoridated water because of potential IQ loss, and dental fluorosis. And the general population has no way of removing fluoride from their water if they don't want it. Poor people cannot afford water filters, and you have to change those filters regularly, and that is an extra financial burden on people who are already financially strapped. And the addition of fluoride to drinking water increases the cost and introduces risk. So they voted it out. The water board was made up of, or is made up of, a lot of professors from Penn State University. These professors read the literature, they read the science, and they could see through the talking points of Johnny Johnson and his little clan. I would like to see the Brown County Board of Health do a fluoride report and evaluate the science, and to put PhD professors on this group to do the report. And to not have lobbyists like Johnny Johnson on this report or to feed them talking points. It has to be unbiased. The group for this report has to be not invested in water fluoridation, not invested in fluoride. They cannot have jobs that make 6 figures or more, soaking kids' teeth in fluoride or painting it on their teeth. These people have to be away from the money profits of fluoride. There's so many dentists that make hundreds of thousands of dollars a year painting fluoride on their patients' teeth. They don't have to do it. The dental hygienist, who is much lower pay than the dentist, can bring in hundreds of thousands of dollars each year into the practice by painting on fluoride. So we don't want dentists that profit hundreds of thousands of dollars on this fluoride review board. And we don't want people who have, been ahead of organizations that have had 6-figure salaries or more from painting fluoride on kids' teeth. Fluoride is neurotoxic to the brain. We are back in court in January for another 2-week trial. We already had a 2-week trial. And everyone admitted fluoride is a neurotoxin. We just don't know what level it's not a neurotoxin. And this NTP report is what everyone was waiting for. And the NTP report found no threshold, no safe level of fluoride. So we're going back to court in January to discuss the NTP report, and there'll be expert witnesses that are called upon to testify. And I just want to remind you guys, use my website. You can find the dates and the Zoom links for any of our court dates. And then if you go to the science page, it has a list of all the science. And it's awesome to compare my science that's archived there to the CDC science, which it's manufactured talking points. Thank you so much for listening to this. I'm sorry it was so long. A much shorter version of this will be provided to the Brown County Board of Health. Have a great day. Thanks.